Another Day, Another Story, by Xavier Production. Exploring environmental health and addressing global health disparities. Introduction. Environmental health. Environmental health is a field of study that investigates how environmental factors impact human health. It encompasses a wide range of factors, including air and water quality, exposure to pollutants, and the effects of climate change on health. Global health disparities. Global health disparities refer to the unequal distribution of health outcomes and healthcare access among different populations around the world. These disparities are influenced by various social, economic, and cultural factors and pose significant challenges to achieving health equity on a global scale. Environmental health. Air quality and respiratory health. Poor air quality, often caused by pollutants such as particulate matter and ozone, can lead to respiratory diseases like asthma and chronic obstructive pulmonary disease, COPD. Research explores the impact of air pollution on lung health and identifies vulnerable populations, such as children and the elderly. Water quality and infectious diseases. Contaminated water sources can lead to waterborne diseases such as cholera, dysentery, and hepatitis. Studies focus on water treatment methods, sanitation improvements, and access to clean drinking water to prevent waterborne illnesses. Pollution and cardiovascular health. Exposure to pollutants, such as fine particulate matter, is associated with an increased risk of cardiovascular diseases, including heart attacks and strokes. Research investigates the mechanisms through which pollution affects the cardiovascular system and informs policies to reduce exposure. Climate change and health risks. Rising global temperatures contribute to heat-related illnesses and the spread of vector-borne diseases like malaria and dengue fever. Studies assess the health impacts of climate change, develop adaptation strategies, and advocate for sustainable practices to mitigate risks. Global health disparities. Healthcare access and inequities. Disparities in healthcare access arise from factors such as poverty, lack of infrastructure, and geographic isolation. Research examines barriers to healthcare services in low-income and underserved regions, aiming to improve access and reduce inequities. Social determinants of health. Social determinants, including education, income, and housing, profoundly influence health outcomes. Studies explore the relationships between social factors and health disparities, offering insights into interventions that address underlying determinants. Maternal and child health disparities. Inequities in maternal and child health contribute to higher rates of maternal and infant mortality in disadvantaged populations. Research focuses on improving access to prenatal care, promoting maternal and child nutrition, and enhancing reproductive health services. Infectious diseases and vulnerable populations. Certain populations, such as refugees, migrants, and marginalized communities, are disproportionately affected by infectious diseases like HIV, AIDS, and tuberculosis. Studies analyze factors that contribute to vulnerability and propose strategies for effective prevention and treatment. Conclusion. Environmental health research highlights the intricate interplay between the environment and human well-being. Addressing global health disparities requires a comprehensive approach that considers social, economic, and cultural factors. By advancing our understanding of both environmental health and global disparities, we can work toward creating a healthier and more equitable world for all. Note: this research paper provides a more detailed exploration of the topics. For an in-depth paper, additional research, data, and references would be needed. Thanks for watching. Xavier Production. Please like and subscribe to our channel.